The most frequent question we encounter during our practice is, how often should we feed our baby? That is first one. Second one is, my baby is continuously sleeping throughout the day and is active during the nights. So how should we feed the baby during the morning time? So important thing you should remember is the answer is quite simple. Whenever the baby is hungry, you should feed the baby. So whenever a baby is born, immediately after birth itself, baby is hungry. And you should try to feed the baby as early as possible. If it is a normal delivery, we usually keep the baby to the mother's nipple immediately after birth itself. For cesarean deliveries, once the mother comes out of the operation theater, we generally try to keep the baby to the mother's nipple. The advantage of this thing is, whenever baby sucks onto the nipple, mother gets stimulated and the milk production starts early. And even the few drops of milk which the baby gets in the initial few hours is sufficient for the baby. When a baby is born, his stomach capacity is very less. As he grows only, the capacity of the stomach increases. So in the initial first 2 to 3 days, even 10 to 15 ml of milk will be sufficient for the baby. By the end of the first week, nearly baby can drink up to 30 ml. By the end of the second week, 60. By the end of third week, 90. As the baby's age progresses, the stomach capacity also increases. In the initial few days, because stomach capacity is less, so baby tend to get hungry early. So they get up very frequently, like every 2 to 3 hours, and you need to feed the baby frequently, especially like per day, at least 10 to 12 times you need to feed your baby in the initial few days. But as baby grows up, after, let us say, after 2 weeks or 3 weeks, then usually they can sleep for 3 to 4 hours, and your feeding interval decreases to around 7 to 9 feeds per day will be sufficient. And other thing is, in the initial few days, babies keep drinking milk for a long time. Like example, 15 to 20 minutes they drink milk. But as they become big, they develop the capacity to drink the whole milk in a 5 to 10 minutes also. So if you ask me how many times, there is no hard and fast rule. It depends on the baby. So basically, you will have to identify the hunger cues of the baby, and then feed the baby based on his demand. This is called as demand feeding. It is very important to identify if the baby is hungry or not. We all think that whenever baby cries, baby is having hunger. So remember, crying is a late sign of hunger. So initially, when the baby starts feeling hunger, he gives some signs. They are called as hunger cues. We need to identify the cues early and start feeding the baby at that time. So initially, whenever baby starts having hunger, so what he does is, he just opens his lips and closes his lips and does a sucking type of movement, and he just turns his head side to side, searching for the nipple and the breast. And slowly he closes his fist and he flexes his limbs and then tries to suck whatever comes in his way, like whatever the clothes, or he sucks his own fingers like that. He can do like that. This happens in the second stage. Once he becomes completely awake, he generally stretches his limbs and flexes it and keeps on squirming and gets irritated. And at the last stage, he starts crying. If you wait till the last stage of crying, baby is usually angry at the parents. So initially, he doesn't accept. So he takes some time to adjust, and then only he takes the milk. So it is always better to identify the signs early and then feed the baby based on the hunger cues. The other important thing is, so based on sucking movements alone, you cannot tell that baby is hungry. Baby can have this sucking type of movements for a lot number of reasons. One thing is the feeling of closeness to the mother. So even then, the babies continuously suck onto their thumbs or fingers, or they do these movements. So you have to see all the other signs and then decide whether baby is hungry or not. Whenever baby is drinking milk, along with the milk, there is some amount of air entering into the stomach. Especially this happens when you are bottle feeding a baby, or you are feeding the baby with a spoon or a palade. Even when a baby is being breastfed, after some time, baby stops feeding from the breast and he just keeps sucking the nipple. During this time, there is no milk coming out from the nipple, but baby tends to swallow air. So basically, the air enters the stomach. The problem with air entering the stomach is, number one, baby will have a feeling of satiety. So even if their tummy is half filled, the other half is filled with air. So they feel that their tummy is full and they don't accept the milk. Second important thing is, this air which is present in the stomach tends to come out. So during this process, there can be hiccups developing to the baby. In the meantime, if baby is coming, like if air is coming out of the stomach, it can come out with some amount of milk. So baby can have small amount of spitting or vomiting type of episodes. The other thing is, whenever the air enters into the smaller bowels or small intestine, baby can have a sensation of a pain, which is called as infantile colic. So basically, to avoid all these problems, you need to burp the baby. There are many ways of burping the baby. So most of them keep the baby on the shoulder and gently pat on the back of the baby. That is one method. There are other methods, like you can hold the baby in the sitting position and then burp the baby, or take the baby on your elbow and then burp the baby. So basically, when you do a perfect burping, so baby can sleep comfortably, and the complications like vomiting or colicky pain can be decreased. Newborns sleep for most of the time. So generally, on the daytime, 8 to 9 hours, in the night time, 8 to 9 hours. So totally around 16 to 18 hours in the initial few days, they keep on sleeping. So why do they sleep so much time? Because most of the brain development and growth of the baby occurs during the sleep only. So it is very important for the baby to have a good amount of sleep. And as baby grows, the time to sleep also keeps on decreasing. It is generally after, by the end of the 3 months or so only, babies will sleep around 12 to 14 hours per day. And the other important thing, why babies sleep during the daytime and why they are awake during the nighttime. This is the common question many parents have. So whenever the baby is inside the mother's womb, so he is inside a fluid which is called as amniotic fluid. So generally, when mothers do their work like walking, climbing the stairs, or doing their household work during the morning time, there is continuous movement of the amniotic fluid happening inside the womb. So this is like keeping the baby in the swing. So they feel relaxed and they tend to sleep during the morning time. So in the night time, when mother is asleep, there are no movement of the fluid happening, and they generally are stayed awake during the night time. That is why most of the pregnant mothers feel their baby kicks during the night time only. So the same cycle continues once the baby is born outside. So they tend to sleep during the morning time and try to be awake in the night time. This type of cycle continues for few days, and by the end of 3 to 4 months, you will be able to identify the sleep cycle of the baby. And the initial few days, babies get up only when they are feeling hungry, or when their diaper is wet, or they get some irritation. That is common for the baby. So as the baby age increases, the time to sleep decreases, and the mother also learns to identify when the baby is hungry and when the baby gets awake as baby age increases. After birth, there are 3 vaccines which has to be given immediately. So one thing is, first one is BCG. BCG is basically for tuberculosis. Second is hepatitis B. This is to prevent the liver infections to the baby. And other thing is the oral polio drops. So that is OPV. These 3 vaccines are the most important vaccines that are immediately given within the first 24 hours as early as possible to the baby. And the next subsequent vaccines will be at 1.5 months, 2.5 months, and 3.5 months. And so many vaccines are there. But these 3 vaccines are the most important one, and to be given to the baby as early as possible after birth. What happens if you don't change the diaper frequently? So whenever you don't change diaper frequently, the diaper is soaked with urine or the feces of the baby, and it is constantly touching the diaper skin, basically. So the skin gets irritated and slowly it start developing redness. And slowly the superficial skin peels off. And then baby starts developing rash over the area. Sometimes the rash can be so severe that there can be ulcers or bleeding from those sides. And baby can have a very bad diaper rash if you don't change diaper frequently. So the ideal way when you should change the diaper is every 3 hourly at least. So per day, at least you should change 8 to 9 diapers. So first thing, whenever baby passes motion, so there is no question. You will have to change the diaper at that moment. But whenever baby passes urine, you may not be knowing whenever baby passes urine. So before every feed, every mother should make a habit of checking the diaper. So if it is wet, you have to change immediately. If it is not wet, usually you can give a gap of 3 hours between a previous diaper change and a new diaper change. By doing this, you can prevent the baby developing diaper rash. Most of us will be thinking like immediately after birth of the baby, you should bath the baby. So this is a wrong thing. You need not bath the baby, especially at least in the initial 24 hours. So many American guidelines says that at least 3 days a week is bathing is enough for the baby. So it depends upon the area and the climate also. Generally, in the initial few days till the baby's umbilical cord is intact, you need not bath the baby. Because whenever the umbilical cord is not fallen and whenever you try to bath the baby, it gets soaked and there is a risk of infection to the umbilical cord. And umbilical cord may take so much time to get fallen. So it is not advisable to give bath to the baby till the umbilical cord falls. And once the umbilical cord is fallen, at least like alternate day bath is sufficient. If parents are in an area where there is high amount of like temperatures, where sweating is more, in such conditions, daily once a bath is sufficient. So on the other time, like example, if you are bathing the baby in the morning, you need not bath the baby in the evening time. You can just take a warm water cloth and just wipe the baby or sponge the baby. That will be sufficient. If the weather is cold and there is no sweating at all, then you can bath the baby on the alternate day. Till you keep the baby's genital areas and the diaper area clean, and all the neck and mouth area where milk is supposed to be drooled and the area gets soaked. If you clean that area, then even if you don't bath the baby, it is not a problem. Mostly I will be concentrating on don'ts for a newborn baby. I'll be telling some 5 to 6 things. First thing is regarding lifting the baby. When you lift the baby up, you should never lift the baby without supporting the head and neck. So remember, whenever you lift the baby, head, neck and body, entire thing should be supported when you are lifting the baby. That is the first important thing. Second, never shake the baby or just don't play with the baby vigorously by just moving him up and down. This is very important. The vessels in the brain are very fragile in them, and there is a high chance of bleeding when you just shake the baby. So never shake the baby. That is the second important thing. Third thing, whenever you are taking the photographs of the baby, don't don't keep the flashes on. So you should not focus or flash the light directly into the eyes of a newborn. That is the third important thing. So other common things are like don't put kajal or to the newborn baby eyes. So by that there is a risk of infecting the eyes, and on top of that the dust in the kajal can block the nasolacrimal duct and babies can have watering of eyes and sticking of eyes like that problem. And the fourth important thing is, in the first 6 months, try to give mother's milk as much as possible. Don't try to give cow's milk or buffalo milk or in fact any human milk. Don't use gripe water. Don't put any oils in the nose, mouth or ear of the baby. And the next important thing is regarding the umbilical cord. So don't apply anything to the umbilical cord even before or after it is fallen. Especially some people have the practice of applying this turmeric powder or paste. Sometimes in some areas cow dung. So many things are there. So nothing should be applied to the cord. Keep it as much dry as possible and allow it to the dry. That is the most important thing.